Hello everyone, welcome back to my channel. In this session, I am planning to discuss something about cerebellum. Many of you had asked me to do a session on cerebellum. So in this session, I will be doing cerebellum. So those who haven't subscribed yet, please do subscribe so that I will feel motivated to more and more videos in future. So before we move on to cerebellum, one important thing which you should understand is the main concept of how the cerebellum is located inside the cranial cavity. So first, before we move on to the location, before we move on to the different parts of the cerebellum, let's see what is actually cerebellum. Cerebellum is otherwise known as little brain. And we know that inside the cranial cavity we have the forebrain, we have the midbrain and we have the hindbrain. So cerebellum is considered as the largest part of hindbrain and it is the second largest part if you consider the entire brain itself. So second largest part if you take the whole brain and the largest part in the hindbrain. And what about the weight of the cerebellum? It is just roughly 150 grams. Now let's see where it is located. We know that when you take the cranial cavity as such, we have the anterior, middle and posterior cranial fossa. So this is actually located in the posterior cranial fossa. So if this is actually a sagittal section and this is the anterior part and this is the posterior part. So we can see the cerebellum is actually seated in the posterior cranial fossa and it is separated from the rest above by a fold, a dural fold. This is known as tentorium cerebelli. So below the tentorium cerebelli, you have the cerebellum seated in the posterior cranial fossa. And anteriorly, what is the important relation? We have the pons and we have the medulla. So anteriorly it is related to pons and medulla but separated from these two by the fourth ventricle. So these are the important relations which you should know when you think about cerebellum, the location of cerebellum. So it is in the posterior cranial fossa below the tentorium cerebelli and anteriorly you have two important relations, the pons and medulla, which are separated from the cerebellum by the fourth ventricle. Now, you know, it cannot be simply seated in the posterior cranial fossa, isn't it? You have the fibers going in and coming out of the cerebellum and connected to various parts of the brain as well as the brainstem. So, the cerebellum is actually anchored or connected to the brainstem, that is the midbrain, pons and medulla through a set of white fibers. They are known as peduncles. So you call it as cerebellar peduncles. So you have three parts for the brainstem, that is midbrain, pons and medulla. So you have three cerebellar peduncles. Superior cerebellar peduncle, middle cerebellar peduncle and inferior cerebellar peduncle. So as the name implies, you know, superior cerebellar peduncle will connect the cerebellum with the midbrain, middle cerebellar peduncle will connect the cerebellum with the pons and the inferior cerebellar peduncle will connect the medulla with the cerebellum. That is how the cerebellum is anchored to the brainstem and that is how the various fibers enter and leave the cerebellum. Now when you consider the cerebellum as such, we know the outer portion you call it as cerebellar cortex and it is made up of grey matter and inner to it you have the white matter. So the pattern of arrangement of cerebellum, we know that they are arranged as leaf-like or sheets of leaves or folia. And in between the folia you have the fissures. So we are not talking about all the fissures, we will be discussing only about the important ones. So you can see these are the leaf-like arrangement of cerebellum and this will increase the surface area. So when you look the cerebellum from outside, only 15% of the cortex is exposed and the remaining part of the cortex is actually pushed into the matter of the cerebellum. 85% of the cerebellar cortex is actually pushed because of this leaf-like arrangement and only 15% of the cerebellar cortex is visualized by you. And in between these foliae you get the fissures. Now the white matter is actually extending into the leaf-like structures of foliae and that will give a branching pattern for the cerebellum and that is why it is known as arbor vitae cerebelli. The branching pattern is because of the white matter which is extending into each leaf of grey matter, and when you look or in a cross section it will look like a tree with branches. That is why it is known as arbor vitae cerebelli. Now when we talk about the functions of cerebellum, you can just remember the code MTP. M stands for motor activity, the different coordination of the motor activity. Then T stands for the tone of the muscles, and P stands for the posture of the trunk. Okay, so these are the three main functions of cerebellum: coordination of the motor activity, then maintaining the tone of the muscles, and maintaining the posture or equilibrium of the body. So what will happen in case of cerebellar diseases? How it is easy to identify a patient if he is suffering from cerebellar diseases by noting the activity, the motor activity, by assessing the tone of the muscles as well as looking at the posture. So if there is any deviation in the motor activity, you call it as dyssynergia. Then tone, if it is affected, it will be hypotonia in case of cerebellar disease, and if posture is affected, it will result in disequilibrium. So this is again very important. The triad of functions of the cerebellum: motor activity, the tone, and posture, MTP. Now before we move on to the external features of cerebellum, first you should know how this cerebellum is folded and kept in the posterior cranial fossa, because most of you, when we talk about the different important fissures, you don't have any idea how it is seated. So first we will clear the concept of how the cerebellum is seated in the posterior cranial fossa. So in the beginning, during the embryological development, we know that the cerebellum is derived from the neural tube. So in the initial period, the tube, it will be elongated and it will be extending from before backwards, anterior to posterior. Now it is said that in embryology, the first fissure to develop in the cerebellum is the posterolateral fissure. So in the beginning, you can imagine the cerebellar portion of the neural tube as an elongated tube with the anterior end and the posterior end, and in embryogenesis, the first fissure to develop is the posterolateral fissure. You can see a gap here. Okay, so this gap is the posterolateral fissure. That is how it got the name as posterolateral fissure. And in course of time, what happened is, you know that the cranial cavity is fixed structure, isn't it? Its size won't increase according to the growth of the brain. So what happens to the brain, the structures of the brain? It has to get folded so that it will be accommodated within the limited cranial cavity. So what happens? The cerebellum will fold on itself so that the posterolateral fissure will now come anteriorly. So that is the reason why when we talk about the posterolateral fissure, we see that this is actually seated anteriorly. So in the beginning, you have the anterior end and posterior end. First fissure to develop will be the posterolateral fissure, and in course of time it will get folded so that it will be just in the form of a closed book. That is how you see the adult cerebellum, and that is why you get the posterolateral fissure seated anteriorly. Now I am going to keep it like this. I think now it's clear for you. You can see the anterior end now here, and the posterior end, which was at the back, got folded, and it is also lying just below the anterior end, so that the posterolateral fissure is actually coming towards the anterior aspect, and we have the pons and medulla lying close to these structures. Now it will be easy for you when we discuss about the structures. So let's see what are the external features of cerebellum. First we will discuss about the parts. It has got three parts. That is, if you consider it like this, you have two cerebellar hemispheres. Just like the cerebral hemispheres, you have two cerebellar hemispheres, and you have a worm-like portion in the middle, a tube-like or worm-like portion in the middle, and that is known as vermis. And vermis, when you look from the upper part, you call it as superior vermis, and when you look from the lower part, you call it as inferior vermis. So that is how you get the important parts of cerebellum. Two cerebellar hemispheres on either side and a worm-like portion which is actually connecting the two cerebellar hemispheres, and that is known as vermis, and From above, if you see, it is called superior vermis, and below, if you see, it is known as inferior vermis. Now, one important thing which I would like to add here is superior vermis is actually in continuation with the two cerebellar hemispheres. But when you see the inferior vermis is actually seated in a gutter, in a narrow space between the two cerebellar hemispheres. That gutter-like depression, you call it as vellicula, cerebellar vellicula. So, inferior vermis is actually seated in a gutter-like depression in the inferior surface, and where the inferior vermis is in that vellicula. But superiorly, if you see the vermis, we cannot actually differentiate vermis from the cerebellar hemispheres because it is actually smoothly blending with the two cerebellar hemispheres. But inferiorly, you can see the two cerebellar hemispheres, and in between the cerebellar hemispheres, you can see a gutter where on the floor of the gutter you will get the inferior vermis. That important portion also you have to remember. Now we will move on to the surfaces of the cerebellum. There are mainly two surfaces. When we keep it like this here, the surface which you see from above, it is known as the superior surface, and the surface which you see from below, it is known as the inferior surface. Now what do you mean by notches? So there are again two main notches. If it is seated like this, there is a notch in the anterior part and there is a notch in the posterior part. Anterior notch is actually shallow and wide. It is not that deep, but it is shallow, but it is wider. Why is it wider? Because it has to accommodate the anterior relation, the pons and medulla. So the anterior notch is actually wider but shallow. But what about the posterior notch? Posterior notch, I have just made a cut here. That means posterior notch is actually narrow. It is not wider. It is narrow but a bit deeper compared to the anterior notch. So why you need a posterior notch here? Because you have another dural fold in the posterior aspect coming like this. That is known as false cerebelli. So false cerebelli is just a paper-like fold coming from the posterior aspect, and it is actually going in between the two cerebellar hemispheres, and it actually separates a portion of the posterior part of the cerebellar hemispheres. So that is why you have the posterior notch, which is actually narrow but a bit deeper than the anterior notch. So that's about the notches. Now we will see the important fissures. We know the cerebellar cortex is actually arranged in the form of leaves or foliae, and we have numerous fissures between these leaf-like cerebellar cortex. But we are talking about only the important fissures which you should be remembering. So let's see what are the important fissures. The first and foremost is the horizontal fissure. Where will you look for the horizontal fissure? We actually mentioned the cerebellum as a longitudinal structure in the beginning, but it is now getting folded like this, isn't it? So this fissure which separates, when we keep it like this fissure which separates the superior surface from the inferior surface, this major fissure, this is known as horizontal fissure. So this fissure which separates the superior surface from the inferior surface, this is known as horizontal fissure. Now coming to the next fissure, that is the posterolateral fissure. Posterolateral fissure we actually mentioned in the beginning. That is the first fissure to develop during embryogenesis, and this is actually separating the main cerebellar hemispheres from the flocculonodular lobe. This is known as the flocculonodular lobe. We will come to the different lobes and different parts of the vermis and the classifications in the coming sessions. So for the time being, you just remember the posterolateral fissure is seen on the posterior-most aspect, but on folding it comes onto the anterior aspect, and that it separates the flocculonodular lobe from the rest of the cerebellar hemisphere. That is the posterolateral fissure. And the third one, the most important one, is the fissura prima. Fissura prima is actually seen on the superior surface. If you keep the cerebellum like this, on the superior surface, you can see one important fissure that is known as fissura prima. And you can see it will come onto the medial aspect, and this will cut the vermis, the superior vermis into anterior 2/3 and posterior 1/3. Or you can just say the fissura prima actually traverses through the vermis at the junction of anterior 2/3 and posterior 1/3 on the superior aspect. That is known as fissura prima. So this is actually a view from the superior surface, superior aspect. If you see, this will be the view, and you can see that the vermis is in the middle and the two cerebellar hemispheres on either side, and it is actually blending with the cerebellar hemispheres. And in the anterior aspect, you can see the pons and medulla, which are the important relations of the cerebellum in the anterior aspect. And this is the view from the inferior surface, and in the inferior surface you can see it is like this. Okay, so this is the inferior surface where you can see the floccular nodular lobe. This is the floccular nodular lobe, and you can see the posterolateral fissure coming onto the anterior aspect due to the folding, and in the middle you can see a gutter like depression that is known as vellicula, where you will get the inferior vermis on the floor of the vellicula. So this is about cerebellum and the important external features, or how the cerebellum will look from outside and where the cerebellum is seated. Please do keep watching, and please subscribe so that you will get notifications, and I'll be doing a session on the classification of cerebellum, the anatomical classification, morphological classification, and the functional classification in the coming session. Please do keep watching. I'll be doing further sessions on the deeper architecture of cerebellum as well. And please leave your comments if you find it useful, and please do share and subscribe. Thank you so much.